right, Dave, thank you. Dr. Zorba Pastor is taking your calls from his clinic in Oregon.
The number to call is 270-9933. Hi, Zorba.
Uh-oh, what's going on?
No, I was just wearing this to remind people. If you think you have the flu or something else, get a mask. It'll help prevent other people from getting it. And make sure that you wipe your hands. You know, you wash your hands with some sort of a hand sanitizer or in the sink. That's very important to make sure it doesn't spread.
All right, let's go to Kimberly in Rio. Hi, Kimberly. What's your question?
I'd like to know if it's possible to have the flu without having a fever.
Oh, good question.
Well, first of all, we in America call the flu a lot of different things. Influenza, real influenza that actually gets you, that you get the immunization for, you're going to have a fever. You're going to have a fever certainly over 100. It might be 101.5 or 102, but you're really going to have that, and you're going to feel really bad. Your muscles are really going to ache. You're just going to be put in bed. I had a guy in here the other day, 65, healthy guy, soccer player, no fat on his body, with flu, just influenza put him down on our ground. Most people who think they have the flu actually have another viral illness. But once again, it's not too late to get your flu shot. We think of it the wrong way. We always think of it as 30% effective. The fact is 30% is better than 0%.
Absolutely.
So if you don't have a fever, it's not the flu? Is that what you're saying?
Well, it's more likely not to be the flu.
Okay.
It's, once again, we make our decision based on clinical judgment, and we start Tamiflu very quickly. Stops the flu a little bit earlier, but by the time you get in, get tested for it, sometimes it just is often too late because you can't get into the doctor's office because there are other people who want to get in there too.
All right, let's go to...
Fever usually accompanies it.
Let's go to Kathy in Janesville. Hi, Kathy. What's your question?
Hi there. I was wondering, my son is 28 years old, and he's constantly tired. He seems run down all the time.
So you wonder what's going on with that?
Yeah,
well,
and I just wonder if it's something he could control with his diet, or if
You know, I'll tell you, especially when young men and young women are tired, first thing I say, go into your doctor, get a preventive exam, find out what's going on. Your thyroid could be off. You could have something else that's off. In terms of biochemistries, you could be drinking too much alcohol. You as his mom may not know that. It might be his diet. It might need exercise. This is where getting a full evaluation really can make a difference in his life, especially at his age.
All right.
Get it checked out. All right, let's go to Carolyn in Reedsburg. Hi, Carolyn. What's your question?
Hi. I want to know, with this new flu strain, how long are people contagious that have had the flu?
Generally, as long as you're sick, you're contagious in terms of a fever, in terms of stuff. But I don't know what the exact number is. It's probably about 5 to 7 days. I can't tell you exactly, but that's about the rule of thumb. Unfortunately, you're most contagious before you have a lot of symptoms.
That's right.
So that's when it's usually spread.
All right, let's go to Linda now in Elroy. Hi, Linda.
Hey, hi, Dr. Zorba.
Hi.
Am I on? Okay. I have diverticulitis, and I have a Jackson Pratt pump and drain in my colon, and I want to know if you ever heard of a Jackson Pratt.
I have. They're very good. If you've got diverticulitis, it's important to follow up with your doc with that draining your colon until it gets better. And then often people will then get off of that drain. And diverticulitis, for those who don't know, is an inflammation of the colon that can be deadly, can be very uncomfortable, or can be minor. Having a good relationship with your doctor makes the difference.
Absolutely.
All right, very good. Let's go to Linda in Wisconsin Dells. Hi, Linda. What's your question?
Yes, Dr. Zorba. I was wondering, years ago, you had suggested over-the-counter meds to every day help you promote good health. One was olive oil, and the other, I believe, was Advil. I was just wondering if you...
Well, during that time, I was probably interested in the role of anti-inflammatories in Alzheimer's disease, which still may be the case, but what the recent research shows, getting your cholesterol under control, taking an aspirin is probably just as good. Olive oil really counts.
All right, we are out of time. Thank you, everyone, for calling in. Zorba, thank you for your time. Get the mask back on.
I need Zorba's mask.
We don't need to sit here.
Got it back.
All right.
Thank you, Zorba. Great to see you.
We'll be right back.